The global attention on the new coronavirus seems to be at an all-time high. To date, there are nearly 100,000 confirmed cases of COVID-19 across the globe. The Ministry of Health has been providing periodic updates to the public on the latest surveillance efforts on this new disease. Belize has done surveillance before for brand new diseases like Zika, chikungunya, and H1N1. But what's different this time around with COVID-19 is that for the first time, we have the capacity to test right here at home, right here at the Central Medical Laboratory.
We are the referral lab for the country. We get samples from PG, Corozal, and we are the only one testing for COVID.
Jovencio Chan and his team at the Central Medical Laboratory play an integral role in the ongoing monitoring. It's here in these labs that the presence of COVID-19 in Belize will first be detected.
Our concern as the lab is how do we detect this new virus? Will we need to send samples outside? And that obviously implies a time of transport, a time for results to return. And a lot of factors are added into that. And so that would limit our capacity to detect in a timely manner.
This was the reality in the past when the country had to wait for weeks for results from samples sent out for testing. However, in February, through the assistance of the Pan American Health Organization, 2 Belizeans traveled to Mexico to be trained to test for COVID-19. Celsa Carrera and Ruby Aguillon are the 2 lab technicians who were trained.
SARS-CoV-2 is the name of the virus that causes the disease COVID-19. To put it in layman's terms, it's like you are looking for a needle in a haystack, basically. So what we have are primers and probes, which would act like a magnet, right? So let's say our virus is the needle. It's a gold standard. It's one of the latest development, even though we had it in the past, but it has been developed to a level that, it's a gold standard. It's the best test there is. PCR, nothing can compare to PCR at the moment.
The lab can now test the suspected case and the results will be available within 24 hours. But the technical expertise is one thing, resources are another. In this case, the number of available testing kits.
We brought those into the country. Those are prepared by the Pan American Health Organization, PAHO, in conjunction with World Health Organization and CDC. So we brought those in country, which we only had 100 reactions. Each country in the Caribbean received 100 reactions, and Central America. The advice was, once this thing blows out of proportion, then the CDC would come in with another kit that is designed for mass testing. This kit is for screening purposes. We cannot do as much as we can with the other kit, but the other kit is not ready as yet.
The test does not go directly to COVID-19. We know that when something new comes, there's always the anxiety, and it's understandable that there's anxiety. People want to know fast. However, in that anxiety, sometimes we tend to overlook certain things, and we run the risk of misusing our resources. Now, with the Baylor College, once a patient fits the criteria for that study, the patient is tested throughout all that panel. Patient is negative, patient proceeds to COVID-19, depending also on the case definitions.
Incidentally, since the end of January 2020, Belize has been included in a study with Baylor College of Medicine that is testing patients with flu-like symptoms for the specific virus causing their illness. So previously, the lab was testing for about 7 different types of viruses. Now, as a part of the Baylor study, it tests for over 20. What would make you do the secondary COVID-19 test?
COVID-19.
Yeah.
Okay. The travel history of the patient, again, as per the case definition, if the person has had contact with a positive COVID-19 or, and I'm just summarizing the case definitions, and section C, which speaks if the person has a severe acute respiratory illness, needs to be hospitalized, and there's no known other cause or etiology for his symptoms.
Sosa noted that since there is the possibility of co-infection, which means a person may have the flu and COVID-19, some samples will be tested for both. In the past 2 weeks, the lab has done 5 COVID-19 tests, all of which were negative.
Regionally, as a region, it's very important because we need the surveillance. We need that system in place so that whenever the virus arrives, right, in the region, we are able to say, okay, SARS-CoV-2 is here. So we will go from a state of preparedness, which we already did, we already prepared, to a state of readiness and rapid response.
And that state of readiness means the technicians are on call to be able to conduct testing at any time in the event of a suspected case.
It could come from anywhere, and we have a plan as to how the sample will be transported from anywhere in the country to arrive with us, and then we will have the lab tech here waiting, and then we start processing. We are well prepared to handle this COVID-19, and we are ready.